Hi everyone, this is your tutor from Nursing Prep Classes. In this video, we are going to discuss about electronic fetal monitoring, EFM. So electronic fetal monitoring is done when we have to detect the status of both mother and the baby during labor. And in this case, there are two devices actually which are applied onto the mother's stomach. One is tocotransducer and another one is ultrasound machine. So tocotransducer is applied on top of the fundus of the uterus where it detects uterine contractions, and ultrasound transducer is applied on the fetal back. We palpate the abdomen of the mother and then we locate the fetal back, and on the fetal back we place this ultrasound transducer from where we can get to know about baby's heart rate. And these machines, this tocotransducer and ultrasound transducer, they interpret the data in the form of graphical representation on the strip, which we call fetal strip. So fetal strip looks something like this. So on the lower section of the graph, we have uterine contractions depicted like this, and above we have fetal heart rate depicted in this way on the graph. So we then try to correlate the relation of the fetal heart rate to that of uterine contractions. So for NCLEX, this is very much important that we should be knowing about the electronic fetal monitoring strip and about the changes which we can see on that strip. So we have this mnemonic VEALCHOP, wheel, chop, which will make things easy for us. We need to just memorize wheel and chop. So VEAL, wheel, which means what condition is this graph of, or what condition is represented on this graph, and CHOP, chop, means what is the reason behind that graphical representation. For example, if we look at V, means variable decelerations. So before I go into decelerations and accelerations, let us talk a bit about accelerations. So accelerations means a rise in the heart rate from the baseline heart rate. So first of all, what is baseline heart rate? For example, let us take a look on this graph. So here we have 120, 130, 140 and 150 as a reading. The heart rate, the baby's heart rate, if you can see closely, most likely stays on 140. So it's on 140, it goes up and then it stays, comes down and stays almost around 140, and then again somewhere around 140, and then it goes up again, stays again on the 140. So for most of the time, the graph, it stayed on 140. So 140 is our baseline. So this is baseline heart rate. So the baseline heart rate in this case is 140, right? So now what is acceleration? Accelerations means increase in the fetal heart rate by 15 beats per minute, lasting for at least 15 seconds. So in this case, the heart rate will increase 140 by 15 beats per minute. That means 140 plus 15, 155 beats per minute, and it will stay onto the line of 155 for at least 15 seconds before it starts coming down to the normal or previous baseline. So the normal fetal heart rate is 110 to 160 beats per minute. And here we have a baseline heart rate of 140 beats per minute. And for it to call accelerations, here the heart rate is increasing by 155. So this is slightly over 150, somewhere around 155. It stays on to 155 and it has to stay there for at least 15 seconds before it starts coming down to the baseline. And then it stays on to the baseline before going up again. And this is what we call acceleration, when the fetal heart rate accelerates or it increases by 15 beats per minute from its original baseline. So this is acceleration. Now what are decelerations? Decelerations means temporary decrease in the fetal heart rate. So the heart rate will decrease from the baseline, and this is what we call decelerations. Now, let us take a look at the physiology. So these are uterine contractions, and this is a graphical representation of fetal heart rate. So what happens is when the mother is experiencing uterine contractions, so with the uterine contractions, when the uterus contracts, the baby's head, it gets squished with the contractions. So those contractions, that pressure from the uterus puts pressure on the baby's head, and as a result the baby's head gets compressed. Along with the head, its placenta and the blood vessels, they all get squished. As a result, the heart rate increases because the baby tries to compensate that problem that he's suffering over there. So if you take a look right here, the uterine contractions, take a look how the uterine contraction has come. It has gone to the peak before it started to coming down, and now here the uterus is relaxing, and then it again got onto the top or its peak, and then again it got relaxed. So these are the uterine contractions. So we have three uterine contractions. Now, in front of the uterine contractions, take a look how the heart rate was increasing along with the uterine contractions. So the uterus contracted, it squished the blood vessels, and it squished the baby's head, to which baby reacted by increasing the heart rate. This is what we call acceleration, and this is totally normal. This is fine. So in front of the uterine contraction, we have acceleration, uterus got relaxed, the heart rate returned back to the baseline. And then again, the another contraction came. It again rose to 155 beats per minute, and then again it started relaxing along with the uterine relaxation. So then again, uterus got contracted, it rose up again. So this is acceleration in comparison to the uterine contractions. And for wheel, acceleration means they are okay. So we are totally okay with the accelerations. We have nothing to do with the accelerations. They are totally fine. Now let us take a look at the another graph. So here we are going to first take a look at early decelerations. So what are decelerations? Decelerations means temporary decrease in the heart rate from the baseline heart rate. Now let us take a look right here. So here the baseline heart rate is 150. It stays on 150 for most of the time. So this is why we are taking the heart rate of the baby as 150 as a baseline. Now, here we have these four uterine contractions, 1, 2, 3, and 4. So the uterine contraction peaks, uterus relaxes, it peaks, it relaxes, it peaks, it relaxes. So in front of this uterine contraction, if we take a look at this point right here, so the fetal heart rate right here on this black graph, we just need to pay attention at the black graph. So ignore this red and green, just focus on the black one. And in front of this uterine contraction, we have this fetal heart rate graph. So take a look. When the contraction was on its peak, the graph dipped. So the fetal heart rate, it dipped. So it decreased a bit, right? And then again, it relaxed. The uterus started relaxing. The fetal heart rate got normal. Uterus started contracting again. Contraction was on top right here. It again got dipped. Then again, uterus started relaxing. It came to the baseline. So pay attention. In front of the uterine contractions, you will see these dips marked by the arrows. So this is a mirror image. If you just forget about these two things and just focus at this and this, you will see these contractions, this heart rate data that is depicted right here is a mirror image of uterine contraction. So pay attention. In front of it, it is dipping. In front of it, it is dipping. In front of it, it is dipping again. In front of this, it is again dipping. So this is a mirror image, and this is exactly how you will be able to figure it out. If it looks like a mirror image of the uterine contraction below, that means that graph is of early deceleration, because as the uterus started contracting, the baby's heart rate started decreasing. Now, in this case, the baby showed a different response. So, the baby normally accelerates, his heart rate accelerates, but in this case, it actually dipped because of that head compression, or because of that blood vessels which were being compressed by the uterine contractions. The heart rate was declining because all the blood vessels, they were squishing. So, the blood supply was lost for a while, and due to that reason there was a dip in the heart rate. But as soon as the uterus relaxed, the blood supply resumed back, and the baby regained his heart rate onto the normal baseline. So this is the reason that we are experiencing a dip. So in front of the uterine contractions, you will see a dip because uterus is contracting. It is compressing the head of the baby along with the blood vessels, due to which the baby loses blood supply momentarily before resuming his heart rate back to normal when the blood supply came back again. So this is as easy as it could be explained. So we are done with early decels too. And the reason for early decels is head compression. You will be asked about this in NCLEX, that what was the reason behind this graph? What does this graph show? So this graph represents, which is a mirror image of uterine contraction. It represents early decelerations. And in front of early decelerations, we have H, which means head compression. So the reason for early decelerations is head compression. And that is again normal. We don't have to do nothing with that. No interventions are needed. That is okay as long as the heart rate does not go to less than 100 beats per minute. So if you see over here, it did not fall to this range below 120. It stayed somewhere right here. So it was way more than 100 beats per minute, and it did not fall below 100 beats per minute, and the baby was able to pick up the heart rate and it got back to the baseline. So as long as it is like that, we are fine with it. No interventions are needed. Now let us take a look at variable decelerations. Variable, as the name indicates, varying, it varies. Now how do we know that it varies? And so take a look at this graph on the red graphical data right here. So in front of the uterine contractions, if you take a look right here, the heart rate should be low, and it did get low, but it, look at this, the baseline here was 140, somewhere around 140, but it dipped to somewhere like 110, and then 110 right here, but way below than 110 right here, somewhere touching 90s, and then again somewhere around 100 right here. So the heart rate was decreasing very low. It was decreasing way too much. So if you see right here, the heart rate was decreasing or dipping way too much, and it was even less than 100 beats per minute. It can go low up to 70 beats per minute as well, or it can stay over there for a very long period of time. That's what we call variable deceleration. And if you see carefully here, with the uterine contraction, it is dipping, the uterus relaxed, it got okay. And then here again, with the uterine contraction, it was not dipping along with it. So if you see, it was dipping way before this. So there was no relation between this and this. And then right here, the heart rate should have been dipping right here at this point in front of it, but it was dipping before uterine contractions came. It then dipped. It did not dip in front of this uterine contraction. It dipped before this uterine contraction right here at this point. So somewhere it is dipping along with the uterine contraction, a bit earlier than the uterine contraction, and then of course earlier than the uterine contraction, and then again on the uterine contraction. So if you see, it varies. So the dipping varies. Somewhere it is dipping along with the uterine contractions, somewhere it is dipping before the uterine contraction. You can even see a dip after the uterine contraction as well. So when the pattern varies like that, that is what we call variable decelerations. And deceleration means decreasing. So this is decrease in the heart rate. Also, there's another way you can find out in the graph that it is of variable deceleration. That is V for variable. And right here, if you take a look, the dipping that you can see on the graph right here, that is also forming a V pattern. So if you take a look carefully, they're all forming V-shaped pattern. So V for this graph, which is forming a dip on it. So that is variable deceleration. Now, what is the reason behind variable decelerations? So the reason behind it is C, cord compression. So the cord is being compressed. It can be due to cord prolapse, when the cord actually prolapses out of vaginal introitus, and due to the cord which has come out of the body, the baby's head can come to lie onto this cord, leading to the compression of the cord. And if the cord gets compressed, the blood supply will be seized. As a result, the baby will have this variable pattern of decreasing heart rate. So the cord compression is the reason behind variable deceleration. Now, what are the interventions we can do for this? So for such patient, we can give positioning of knee chest position or all fours position to this lady, and we will stop oxytocin. No oxytocin would be given to this lady. So if it is oxytocin is being run, we are going to stop it. We are going to administer oxygen, and we are going to push head up. So we are going to insert, put on the gloves. So with the gloved hand, with the two fingers, we are taking the fingers into the vaginal canal and lifting the head of the baby up from the cord, so that the cord's blood supply can be resumed, or the condition of the patient can be made stable, so that we can take her for cesarean section. So these are the interventions for variable decels: knee chest position or all fours, stop the oxytocin, give oxygen, and push the head up. Next coming on to is L, late decelerations. So like the name indicates, late, they are late. Decels should have been occurring with the uterine contraction, but they are occurring late. So take a look at this green graphical representation. So if we take a look here, forget about the baseline heart rate right here. I know this is way too less, and this is just a representation to make you understand. So right here, take a look at the baseline. Now let us take a look here. So the uterine contraction is peaking right here. It should have been right here. Contraction's peak is right here. The dipping should have been somewhere right here. Contraction was right here. The dipping should have been somewhere right here. But what is happening? The dipping is coming after the uterine contractions, means they are late. So here's the uterine contraction. Here is the dip. Here is the uterine contraction. There goes the dip. Then there is a dip while the uterus was contracting early. So actually, when the uterus was relaxing, the heart rate should not have been dipping, but heart rate is going down because after the uterine contraction is over or when the uterus is relaxing. So this is why we call it late deceleration. So if you can see carefully, late deceleration, so you see a U-shaped pattern. So take a look at this, like this, and right here. So we have V for variable decelerations in the graph, and this is actually how you can spot this graph. So you can spot this graph with the dippings showing us some U-shaped pattern. Rather than V, we are looking at U-shaped pattern. So U-shaped pattern means late decels, and obviously they will be coming after the uterine contraction is over, like that. So after uterine contraction is right here, it is coming later. So these are late decelerations. Now, what is the cause for late deceleration? The cause is P, placental or uteroplacental insufficiency. You can even remember this like uteroplacental insufficiency. So you see U in the graph. So uteroplacental insufficiency or placental insufficiency means the placenta is not getting enough oxygen or the nutrients for the baby to pass it on, and therefore as a result the baby is showing decrease in the heart rate because the blood supply which is going towards the baby is getting some problem somewhere and the baby is lacking that blood supply. So it can be caused due to some damage to the placenta or any underlying disease condition that is impeding the flow of blood towards the baby. So what do we do in this case? So for this case, where we have late deceleration and placental insufficiency, you need to remember the mnemonic LIONS, Lions, lions. So L for we give left lateral sideline position to the lady. I for we are giving IV fluids to this lady. And O for we are giving oxygen. N for we are notifying it to the doctor. And at last, S for we are stopping the oxytocin. So that is all about electronic fetal monitoring, and this graph is really important for NCLEX point of view, and I really hope that you have understood it pretty well. And for the online classes, you can contact us on the number which is given below in the description box. Thank you so much.